Thank you, Angela. I am so excited to share more about BreezeBubble with all of you. So let's get right into it. Los Angeles, Tokyo, and Sao Paulo. These three big, beautiful, and bustling metropolitan cities are home to 30 million people. Lately, these sought after cities look more like this due to air quality deteriorating from bad to worse and has reached severe levels. But this isn't just a reality for these three cities. In fact, according to the World Health Organization, 9 out of 10 people in the world breathe polluted air. In 2018, this meant a $2.9 trillion global economic cost, 4.5 million deaths, and 4 million new cases of child asthma. I've personally experienced the growing problem of air pollution and have seen it directly impact the lives of my friends and family. My dad loves running marathons, but in the months of extremely bad air pollution, he completely stops preparing for them, and my mom doesn't go outside for weeks. I tried several solutions to solve this problem, but the options that were available were either uncomfortable or ineffective. That's why I developed the BreezeBubble mask, a sustainable solution that makes it comfortable to breathe clean air in polluted environments and live an active life freely and comfortably. Our mask is washable and reusable, it's lightweight and customizable, and it does not fog up the wearer's glasses. It has three key aspects. The first is the unique and flexible edge design that takes the shape of the wearer's face and creates an airtight seal. Our BFE 99 certified filters are effective against bacteria, viruses, smoke, and PM 2.5 particles. Our future version also includes breathing sensors and a rechargeable fan device that can provide added breathability and comfort. I started working on this idea before the pandemic since this problem's been going on for years. But COVID brought masks to the forefront, and in just 1 year, 52 billion face masks were produced, which entered our landfills and oceans. And they take 450 years to decompose. With BreezeBubble, we provide a sustainable and reusable solution to the problem of air pollution while reducing the burden on the environment. Now, I know what you're thinking. There's a million masks out there, but we have a unique competitive advantage because most other masks have a trade-off. The ones that are comfortable, like the cloth or surgical mask, don't provide effective protection, whereas the high protection masks like the N95 are uncomfortable, restrictive, and difficult to breathe through. The BreezeBubble provides the best of both worlds by offering a combination of both to the user. It's also more affordable than disposable masks in the long run. The standard N95 costs about $500 for 6 months of use. The surgical mask costs about $90, and the BreezeBubble only $40 for a high quality solution. At our product launch on Kickstarter, we blew past our funding goal within the first 48 hours and reached a large number of backers with zero marketing dollars spent. In 1 year of operations, we've done $80,000 in sales and acquired over 1,000 customers. Our profit margins are 70% for the mask and about 95% for the filter packs. Our filter packs are part of our recurring revenue business model, which are bought by 78% of our customer base. During the pandemic, I pivoted the product and market to servicing the COVID demand since the need for masks had changed. Our long-term goal is still to cater to millions of people in countries like India, China, Brazil, Mexico, and parts of the US where people breathe polluted air. This market is expected to grow at a rate of 53% in the next 5 to 7 years and has high potential for impact and innovation. The current market size for this business stands at about $21 billion in the consumer segment and $13 billion in the B2B segment. Breaking these two down, we see that on the consumer side, wildfire smoke, industry emissions, and vehicular exhaust affect about 135 million Americans who are our initial target market. We've also identified potential markets in the B2B segment, like the healthcare sector, public safety and defense, the manufacturing industry, and mining and construction. So how are we going to tackle all of this? The game plan is to first target the US B2C consumer market from where most of our current sales are coming from. The next step would be to expand to the global consumer market, starting with Japan, since it has a lot of scope for premium masks. After that, we plan to target the B2B industry since it has a considerable market share, and it will also help with our exit strategy, which is to get acquired by a large company like 3M or Honeywell, who have a large focus on the B2B business model. And we're raising $250,000 in seed funding to expand our customer base in 2022 and conquer this first step of the roadmap. To help scale the business, I have some key mentors and advisors who are helping in various aspects. Satish Malnaik, the CEO of Next Services, is helping with business development and market strategy. Gay McGregor is the US EPA Senior Policy Advisor. Deborah Stapleton is an Asian business consultant who can help expand internationally. Walker McHugh, the founder of Refractal, is helping with product development and fundraising strategies. And Dr. Mirko Gamba is lab testing the efficacy of the product. Also, the organizations Ann Arbor Spark, the Desai Accelerator, and the Zellery Institute have helped tremendously in providing networks, grants, funding, and resources. The strong team of advisors and support organizations will continually help to grow and scale the company. I want to end by saying that our goal at BreezeBubble is to ensure quality breathing for everyone to live an active, healthy, and happy life. Thank you all so much for listening, and I'm happy to take any questions.
I have a question. First of all, congratulations. Nice presentation. Sad to think that our world's gotten to this state, but I'm glad people like you are addressing it this way. My question is, aside from the money that you're raising, what, in your opinion, is the most valuable help or guidance or luck even that you need in the next year to help you make the next 1 year step toward your goals?
Yeah, thank you for that question. There's two key areas that I plan to target in the next year, which is where I would need the most help. So the first is in product development. We're constantly innovating. And as I mentioned, with our fan device and breathing sensors, that would be really the next version of this mask that could help with breathability, comfort. It could make it more effective and have so many more uses. So that's one area where if I could work with a biotech engineer or somebody who's in material sciences who could advise me on this product development area would be really helpful. And the other side is really like expanding the business and acquiring more customers. So just somebody who can help make those connections to the industry or people who are in this segment would be helpful as well, other than the fundraising.
Okay, thanks. I like the translucent nature of it too. That's really cool.
Arohi, am I saying your name right?
Yes.
So it seems like if it's true that it's as effective and more comfortable than like a traditional N95 mask, that could have massive like impacts like on the medical community, but it's not disposable. Have you like done any research at all into like how important the disposable nature is? Like would a medical facility ever reuse a mask, or is that like a deal breaker for them?
No, that's a great question. So I worked with Henry Ford Health Systems before for a bit, where they tested the mask with their lab technicians and radiologists. And since the filter packs themselves are the disposable aspect, the only thing that they need to do is sanitize the mask from the outside. So that would be something that they would need to incorporate in their systems. But yeah, like
what was the feedback when you worked with them? Did they say were they receptive to it, or did they like it? What did they say?
They definitely liked the masks. Where we had a standstill was we need like a lot of FDA approvals to get it actually into like all of their hospitals. So that's definitely something that I'm working towards with Dr. Mirko Gamba, getting the lab testing done and then getting those certifications, which is also an expensive process. So that's, I think, 1 or 2 years until we target hospitals and healthcare systems, but that's definitely in the pipeline. As of now, the general consumer market is the target.
How much, like how long and how much do you think that would cost to get FDA approval?
So there's about 12 to 15 tests needed in the full N95 certification, which cost anywhere from about $15,000 to $18,000. And other than that, we would need, like for some of the other like more smaller tests, we would need an additional like $2,000 to $5,000 to get the whole thing done.
Cool, great job, thanks.
Thank you.
Hi, great job. This is Renee. 2 questions. One, is there a part of your technology that can be patented? And then my second question is, as you look to expand globally, I love the fact that you're going after markets like the US and Japan with more higher disposable income, as you look to expand globally into other markets like India, China, which have higher disposable income, but if you want to reach the masses, you've got to look at lower price points. Is your strategy that by then you would have been acquired and then they'll lower the price point? Or what do you do? What's your thought around your pricing strategy as you start to expand into all these international markets?
Yeah, definitely. I mean, I'm already working on, like, as our volumes are growing, the cost of the product itself and cost of development is going down. So when I target, let's say, Japan or India, the cost needs to be reduced much further. I'm in like talking to two of the Japanese distributors who are trying to test the mask with their consumers. So we're kind of having back and forth conversations on like what the price point is going to be and what the consumers are going to have. And I think Japan is a good starting point as well because of the premium masks aspect. Like there's a lot of these more high quality, more higher priced masks that are coming in. So they can be good early adopters of that. And could you remind me of the first question again?
Patented technology.
Right. So I did talk to a patent attorney and they said that right now with the influx of applications coming in for masks and like all types of patents, it wouldn't be cost effective at this point as a small startup to get this mask patented. But what we did talk about was that with this second version that I'm working on with a fan device or breathing sensors, that's definitely something where I can apply for a patent and get that protected.
Hi, amazing work with all the things that you're accomplishing. Given that there's so much going on with like international expansion and then all these testing and regulation things that's happening, curious to know, can you talk a little bit more about your team and who would be like your next big hire to get to all those next steps?
Thank you. That's a great question. So I'm a full solo founder right now. In the past year, I've worked with UMich interns, some of the Desai team, and some of the mentors who really helped me with all these aspects of the business. And my next hire would be one would be a biotech engineer who can help with that product development. And the second would be somebody who's really good at sales and marketing who can help grow organically, even if we don't have external funding or marketing dollars.